Dr.R Sickle, and I welcome you to this platform. Today we will be speaking on managing sickle cell well at home. Living with sickle cell condition, puts you under the vulnerable group that is advised to stay at home during this COVID-19 period. Which is why the topic for today is very important, and it's imperative that you know the formula that will help you to manage sickle cell disorder at home. First of all, you need to have what we call an individual self-care plan. What's an individual self-care plan? An individual self-care plan is a written down plan that you will have and you will put up with the help of your doctor to help you participate or take an active role in managing your condition at home to avoid crisis and live healthy most of the time. How do you get or how do you write down a good individual self-care plan? The first thing you need to put on your individual self-care plan is your steady state PCB. What's the steady state PCB? Steady state PCB is your PCB when you are not having crisis, when you are in what we call a steady state level of fitness. You're healthy, you're strong, and you're without crisis. That PCB is what we call the PCB that you have at that point in time is your stable state PCB. So you know that you need to take note of your stable state PCB or your steady state PCB and maintain it, which means that a drop in your PCB level or your steady state PCB level can tip you off crisis that is about before you. Of course, you know the normal red blood cell lives for 120 days, but a sickle red blood cell lives for just 10 to 20 days. So that will help you to answer the question of how often you should check your PCB. But of course, with the help of your doctor, he or she will tell you when you should check your PCB. For me, from knowing that the red blood cell or the red blood cell of the sickle cell individual stays or lives for just 10 to 20 days will also make you to know that I, on my own part, will advise you to check your PCB every month. Knowing that will help you to take precautionary measures against the crisis that is about to befall you. The second thing on your individual self-care plan should be an organization of all the sickle cell related documents, even from your doctor's phone number to appointment schedule to your test results to your medication tracking sheet and even to your transfusion tracking sheet. These things are very, very important. Now, reasons being that when you need them or in case of an emergency, you can actually get them easily and it can help to reduce the number of hours you will spend if there's any emergency. And also having a personal doctor will help you as well to reduce the emergency hours or the frequency to the emergency unit. So it's good as one living with sickle cell to have a personal doctor. Moving on to the next thing on our individual self-care, on your individual self-care plan. You should know your meds. What works for you and what doesn't work for you. And you discuss changes with your doctor. Number 4, we have number 1. Stable state PCB, I think I've talked about that. Number 2, the organization of all the sickle cell related documents, I think I've talked about it. Number 3 will be knowing your medications and the ones that work for you and the ones that don't work for you, and you can change them, or you have to discuss the changes with your doctor first. Then number 4 will be temperature. Temperature is very important, especially for children with sickle cell condition. As a parent, you need to have a thermometer handy for your child. And a frequent record of this or checking of his temperature or his or her temperature will help you to know when he had a spike in his body temperature. Of course, fever can also suggest an infection or even any kind of crisis is about to befall your child. Number 5 would be drinking water tracking sheets. We can't deny the importance of drinking water. Drinking water is very, very important, which is why you need to have a drinking water tracking sheet. It's advisable for individuals living with sickle cell to at least drink 8 to 10 glasses of water. But if you can go beyond 8 to 10 glasses of water and drink even more, that's super. As for those of you who don't like water, there are other alternatives to drinking water, from fruits that have lots of water, and to even drinks like energy drinks. But it's important that you drink water liberally, as much as you can, as much as your body can. But of course, if you cannot, try as much as possible to drink up to 8 glasses of water, and then we can be content that you're drinking water. And of course, with the tracking sheet, it will help you to monitor and it will also help you to know how to drink water even when you don't feel like drinking water. Because water is very, very important. Thank you. That's what living with sickle cell. Then the next thing would be things that trigger crisis. That will be the next one we come. What triggers crisis? Of course, living with sickle cell does not mean that you're going to be sick all the time. It's just a condition that most of the time we live healthy and then just have a little bit of interruption from time to time with crisis, coming down with crisis. Crisis just interrupts the healthy lifestyle, or the healthy life rather. So it's like you're living with sickle cell, but you're actually healthy, and then in between the normal life, crisis come, some may be acute, and in some cases, unfortunately, can be serious and even fatal if it's not controlled, or if there is no emergency intervention. So it doesn't mean that living with sickle cell just means that you will be sick all the time. However, that will also make you to know that you need to know what triggers crisis. Everybody has what triggers. It's when you ask somebody, when do you normally have to say, oh, during the wet season, during winter, during summer, whatever, like during extreme weather conditions. Some people will say that, some people will say other things, These are the things you need to pick. So you have to think, what times do crises come? Or what actually causes crisis? Some people know that when they go outside without putting on pullovers, or they go into a cold water tub, they would actually have crisis. These are things you already know. These things, you note them and do what? You avoid them. Also, the same thing, the season is coming. Maybe like the cold weather season is coming, and you know what you have to do. Take precautionary measures in order to avoid crisis. Then the next one we'll be talking about is drug compliance and results. It's also important. Of course, you don't have to abuse drugs, especially pain medications and antibiotics. Your drug compliance and testing, tracking shit as well will also help to know which drug is working for you and which is not. And all that will also help the doctor to help change your drugs as well. Having said all of this, which other things should we put into consideration when we are home to help us manage sickle cell? Of course, diet. Food should be your medicine. Now, when I say food should be your medicine, I cannot say you should be eating food without any control. Of course, portion control is important, and your 6 nutrients are also important. So you have to include the 6 nutrients in every meal that you take, and of course, portion control. Number 2, avoid infection. How can you avoid infection? Number 1, of course, washing your hands regularly under running water with soap. Number 2, safe food and water handling is very, very important. Safe food and water handling. Number 3, rest as much as you have the opportunity to. Number 4, try not to overwork yourself mentally. You know, mental stress has a way of dealing with us. I also forgot to include recording your stress level. Of course, we know what we can handle. I mean, in your individual self-care plan, you also have to record the stress level so that it helps you to limit, the stress level and stress in your life. Know when you should continue and when you should stop. And as I said, I talked about moving on, trying not to overwork yourself mentally. Of course, you also need to rest as much as possible. Then, don't forget your routine checkup. It's very important. Don't forget your routine checkup with the doctor. That will also help, and it will also depend on how well you can manage yourself. Then there are other things you should not ignore. Number 1, signs you shouldn't ignore. Fever you shouldn't ignore. Difficulty in breathing you shouldn't ignore. Chest pain you shouldn't ignore. Numbness in one side of your body. You can feel your face, you can feel your legs, you can walk, you shouldn't ignore. Pains that will not go away even after taking painkillers, you shouldn't ignore. You shouldn't ignore seizures. You shouldn't ignore painful erection for guys. You shouldn't ignore abdominal pains. You shouldn't ignore dizziness, headaches, even leg pains, continuous leg pain, usually at the head of the hip bone. Of course, you should know that that may also imply osteoporosis of the head of that particular bone. So you shouldn't also ignore. And many other signs you shouldn't ignore. When we do this a lot, I believe that we can help ourselves, and I can also help you manage sickle cell at home. Thank you very much. I hope you learned something today. You learned about individual self-care plan and what you should include. And once you do that, to help you to stay at home without having to run to the emergency centers all the time, to help you to control your condition at home, whether of your child. And also, of course, I talked about good food, I talked about hydration, I talked about rest, I talked about knowing your stress level, and I talked about signs that you shouldn't ignore. And of course, lastly, always be positive. Being positive goes a long way in helping you stay healthy, stay safe, and stay happy. Thank you very much, Dr.R. once again. Bye-bye.